Hi everybody, I'm Dr. Bhargav Raut from Pathofast Lab Pune. And if you've noticed foamy or frothy urine in the toilet and you're pregnant, this is a video that's made just for you. So, foamy or frothy urine can sometimes be normal, but it could also be a cause for concern. And if you've been having this symptom repeatedly during your pregnancy, this is something that you should be looking into. So, we are going to talk about what are the most serious causes of this foamy urine and what are the non serious causes. So first of all, what is foamy urine? As you may have realized, it's this appearance of this bubbly or frothy urine on top that you see after peeing. It's usually because of something which is called proteins. These are some substances that make their way into your urine. Even when a little bit of this is supposed to be normal, but if you're noticing a lot of froth or foam in your urine, it's probably because of a lot of proteins, and that is not normal. Secondly, during pregnancy, this is important because increased proteins in urine during pregnancy may be seen in some serious conditions like preeclampsia, HELP syndrome, diabetes, and a few others, which I'll explain in the next few slides. It's important to note this finding, and if you feel that you have one of these other conditions, you should definitely get it investigated. So first of all, why do proteins cause foamy urine? Proteins are basically like soap, and when soap or like a protein is added to any kind of liquid, it causes its surface tension to increase, and this leads to the formation or a trapping of air in that liquid, and then you see these bubbles. So proteins are always the underlying reason, as you can see on the image to the left. If you're passing more than 300 milligrams a day of protein in your urine, you're going to get probably the formation of this froth. So it's just basically a sign of increased proteins. Now, what are the causes of foamy urine during pregnancy? So the most common cause is basically just the pregnancy itself. This adds load to your kidneys. Your kidneys leak a little bit of protein into the urine and that causes the foam. There is nothing abnormal in that. However, there are some conditions which are important and abnormal which you need to know about, which is basically the first one, which is preeclampsia. This is a condition in which your blood pressure will increase together with this leakage of proteins into your urine. Another one is also called the HELP syndrome, which basically has some impact on your liver as well as a reduced number of platelets in your blood. Both of these can damage your kidneys and lead to increased protein in your urine. The third and one of the common causes would be the gestational diabetes. Basically, this is diabetes during pregnancy, increased sugar during pregnancy, which then affects your kidneys, and then your kidneys get damaged and leak protein into the urine. The last two causes are basically a kidney disease itself. This might be seen in some autoimmune diseases like lupus. It may also be an infection in the kidney or an infection in your urine, both of which can cause cloudy or frothy urine. The last one is simple, which is dehydration. You're not drinking enough water. Your urine is getting concentrated, and because of that, its relative concentration of proteins in your urine are increasing, and that is causing this frothy appearance. Now, what is preeclampsia? As I said, this is a situation in which during pregnancy your blood pressure increases a lot. You may notice things like severe headaches, changes in your vision. You might see blurry dark spots in your vision suddenly, pain in your stomach, sudden swelling on your legs, and increased weight. All these are some signs that you may see together with increased blood pressure and frothy urine. How do we measure this? The simplest way is get your blood pressure checked from your local doctor. You should do this around 20 weeks after pregnancy. And what is the cutoff? Basically, if your blood pressure is more than 140 by 90 on two separate occasions that are at least 4 hours apart. The other sign would be an increased amount of protein in the urine, which you can just come to know from a simple urine test. You may also do some blood tests like liver tests, liver function tests, and kidney function tests to know whether your kidneys are being affected by preeclampsia. Note that preeclampsia is a really dangerous condition. It can have disastrous effects on your pregnancy. So if you feel that you may be having preeclampsia, you need to get to the nearest gynecologist as soon as possible and get yourself checked. The other cause is diabetes in urine, diabetes in pregnancy. Basically, what happens is that your sugar levels increase, it impacts your kidney, and the kidney leaks proteins into the urine. How do we diagnose this? Around 24 to 28 weeks of pregnancy, you will need a blood test called the oral glucose tolerance test. I've linked to it in this video at the end. This basically checks how well your body is handling sugar. If this test is positive, you may be diagnosed with gestational diabetes mellitus. How does it cause foamy urine? Well, basically, the diabetes damages the kidney and that then leaks protein into the urine, which then causes the foam. What about infections? Well, if your kidney is infected by any kind of bacterial infection, that can damage the kidney and proteins will leak into your urine. And again, as you know, that causes foamy urine. You may have also some kind of autoimmune diseases like lupus, which can damage your kidney. You may also notice symptoms like a frequent urge to urinate, pain on the upper right or upper left side of your back, fever, chills, cloudy or dark urine. These could also be seen if you have an infection lower down in your urinary tract, not just in your kidney, which can also cause your urine to become cloudy or frothy. The last but maybe one of the most common causes is dehydration. You're not drinking enough water, your urine is getting concentrated, every waste substance in your urine is increasing in amount, and this is causing your urine to froth. So you need to make sure that you drink enough water. If you have symptoms like you feel your lips are dry, your mouth is dry, you feel like drinking water all the time, these are all signs of dehydration. So some things to remember. The most dangerous cause of frothy, foamy urine is preeclampsia. You need to get checked for that immediately if you feel that you might be having this. Others are causes like diabetes, autoimmune diseases of the kidney like lupus, and some simple causes just like dehydration. And last but not the least, it could just be because of the load of pregnancy on your kidneys, which is totally normal. Thank you.